Background. This study was conducted to assess functional outcome in intertrochanteric fractured femur treated with trochanteric stabilizing plates and define ideal mode of fixation for such fractures. Trochanteric stabilizing plates is a modular extension of dynamic hip screw that is mounted on the lateral femoral wall to stabilize the greater trochanter. It provides adequate flexibility to achieve plate to bone apposition as well as axial compression or angular stability because 3 screw fixations at the proximal fragment. Trochanteric stabilizing plates can provide a stress shield for the lateral trochanteric wall and prevent lateral migration of the proximal fragments of femur. It does not fail at the screw bone interface and provides strong anchor at the osteoporotic bone. The multiple locking screw holes provide various options to tackle complex fracture patterns. It functions as an internalized external fixator and minimizes the pressure on the periosteum and encourages biological healing. Methodology. Department of Orthopaedic, it was done at Digvijay Patil Medical College, Navi Mumbai. Study population was patients with intertrochanteric fractures of Boyd and Griffin's classification 1 to 4. Study design, a prospective observational study design was used. A functional outcome was assessed during the using the hip Harris score. Sample size calculation, a total of 30 patients of intertrochanteric fractures undergoing treatment with trochanteric stabilization plates were used. Study duration was conducted from July 2020 to December 22. Patients admitted with IT fractures were examined and investigated with X-ray pelvis with both hips in AP and lateral views. After plating, patients were assessed in the first week, second, third, and 12th week, 6th, 9th, and 12th month. In each follow-up, functional hip score using the Harris hip score, range of motion, and time taken for the patients to start weight bearing was calculated. And time for bony union was noted on based on radiological investigations. This is one of the cases that we had done at DY. This is the Harris hip score. Statistical analysis. The quantitative data was represented as their mean as mean. Categorical and nominal data was expressed in percentage. The t-test was used for analyzing quantitative data, or else non-parametric data was analyzed by Mann-Whitney test, and categorical data was analyzed by using chi-square test. All analysis was carried out by using SPSS software version 21. Results. Mean age of the study group was 68.9 years. Female predominance was observed in the study with 70% of female subjects and 30% of males. Right side was predominantly involved. Associated comorbs were in the diabetes and hypertension. Most common mode of injury was trivial fall, mean blood loss or complications. Time to independent full weight bearing noted was 1.21 weeks, the mean time, and the return to pre-fracture level of normal activity was 16.5 weeks, and complete union was achieved in 14.42 weeks. Trochanteric buttress plates creates a biomechanically stable construct incorporating the comminuted trochanter. It restores proximal femoral anatomy, ensuring anatomical reduction, and reduces limb length discrepancy. Thus, we can conclude that trochanteric stabilizing plates of intertrochanteric fractures is an effective technique and has excellent functional and radiological outcomes. Thank you.